Hello and welcome. Today, we're diving deep into a condition that affects many women: ovarian endometrioma, sometimes called a cochlear cyst. We'll explore what it is, what causes it, and how it's treated. Let's get started. The exact cause of ovarian endometriomas isn't fully understood, but the leading theory is retrograde menstruation. This is when menstrual blood containing endometrial cells, the cells that line the uterus, flows backward through the fallopian tubes and into the pelvic cavity instead of exiting the body. These cells can then implant on the ovaries and other pelvic organs. Other possible factors include immune system problems that prevent the body from recognizing and destroying misplaced endometrial tissue, and genetic predispositions, suggesting that endometriomas can run in families. Now let's talk about how ovarian endometriomas develop. When endometrial cells implant on the ovary, they respond to hormonal fluctuations, just like the cells lining the uterus. During menstruation, these misplaced cells bleed. But unlike menstrual blood leaving the body, this blood becomes trapped within the ovary, forming a cyst-like structure filled with dark, old blood. This gives the cyst its characteristic chocolate-like appearance, hence the name cochlear cyst. Over time, the cyst can grow in size and cause various complications. Ovarian endometriomas are a component of endometriosis, a condition that affects an estimated 10% of women of reproductive age. While the exact prevalence of ovarian endometriomas within this population varies, studies suggest they account for a significant proportion of endometriosis cases. Endometriosis is more commonly diagnosed in women in their 30s and 40s, but it can affect women from puberty to menopause. Certain factors, such as having a family history of endometriosis or having shorter menstrual cycles, may increase the risk. The symptoms of ovarian endometriomas can vary significantly from woman to woman. Some may experience no symptoms at all, while others suffer from debilitating pain. Common symptoms include pelvic pain, especially during menstruation, painful intercourse, dyspareunia, heavy bleeding during periods, menorrhagia, irregular periods, and infertility. The size and location of the endometrioma, as well as the extent of the endometriosis, can influence the severity of symptoms. It's important to note that these symptoms can also be associated with other conditions, so a proper diagnosis is crucial. Diagnosing an ovarian endometrioma typically involves a combination of medical history review, physical examination, and imaging tests. A pelvic exam can help the doctor identify any abnormalities in the pelvic organs. Transvaginal ultrasound is the most common imaging technique used to visualize the ovaries and detect the presence of cysts. Magnetic resonance imaging (MRI) may be used for a more detailed assessment, especially when differentiating endometriomas from other types of ovarian cysts. In some cases, laparoscopy, a minimally invasive surgical procedure, may be necessary to confirm the diagnosis and evaluate the extent of endometriosis. While we don't specifically classify ovarian endometriomas into distinct types, their size, location, and association with other endometriotic lesions can influence the treatment approach. Endometriomas can be unilateral, as affecting one ovary, or bilateral, affecting both ovaries. They can also occur alongside other forms of endometriosis, such as deep infiltrating endometriosis, which involves the bowel, bladder, or other pelvic organs. Understanding these factors is crucial for tailoring the most appropriate treatment plan. Treatment for ovarian endometriomas depends on the severity of symptoms, the woman's age and desire for future fertility, and the size and location of the endometrioma. Treatment options include pain management with medications like NSAIDs or hormonal therapies such as birth control pills or GnRH agonists to suppress ovarian function. Surgical options include cystectomy, which involves removing the endometrioma while preserving the ovary, and oophorectomy, which involves removing the entire ovary. Surgery is usually considered when pain is severe, medical management fails, or if there are concerns about the endometrioma's size or characteristics. Assisted reproductive technologies, such as in vitro fertilization (IVF), may be necessary for women with endometriomas who are struggling to conceive. Currently, there's no definitive way to prevent ovarian endometriomas. However, some strategies may help reduce the risk or slow their progression. These include lifestyle modifications, such as maintaining a healthy weight, exercising regularly, and avoiding excessive alcohol and caffeine consumption. Hormonal therapies, such as birth control pills, may also help prevent the development or recurrence of endometriomas. Early diagnosis and treatment of endometriosis can also play a role in preventing the formation of ovarian endometriomas. The prognosis for women with ovarian endometriomas varies depending on the severity of the condition, the effectiveness of treatment, and the woman's individual circumstances. While endometriomas can cause significant pain and infertility, many women can successfully manage their symptoms and achieve pregnancy with appropriate treatment. Recent research focuses on developing more targeted therapies for endometriosis and endometriomas, including medications that specifically block the growth of endometrial tissue and less invasive surgical techniques. Researchers are also exploring the role of the immune system and genetics in the development of endometriosis to identify new targets for prevention and treatment. Ultimately, managing ovarian endometriomas requires a personalized approach, working closely with a healthcare provider to develop the most effective treatment plan. Thank you for watching.